Okay, welcome everybody. Good morning to some in the Central Standard Time Zone, and good afternoon to those in Eastern Time Zone. We're excited to launch this new forum with all of you today as our inaugural town hall. We've created it to strengthen awareness, alignment, and transparency as we move into an important new phase of the Bridge Northwest program. The town halls will be held on a quarterly basis and are intended to provide a consistent space to share where we are at in the program, what's ahead, and what this work means across our region. I want to start by acknowledging today the significant effort happening across all of your sites. We know this transformation is complex, and we truly appreciate the commitment that you and your teams are bringing to this work. And we know that it has been a lot of work over the past number of months, and you'll hear about what's coming up next. We'd also like to thank those of you who submitted questions in advance. We'll be addressing several of those questions, several of the frequently asked questions that we're hearing from sites in this meeting, and that is one of the main intents of today's session. I also want to highlight that today's session is designed to be interactive, so we'll be sharing a few poll questions throughout the session and encourage you to participate via the polls. I'm pleased to introduce our interim regional chief information officer, Mark Farrow, who will ground us in the broader clinical transformation and how the Bridge Northwest program supports that vision. So over to you, Mark.
Great. Thank you very much, Jessica. So, pull the next slide, please. I just want to start by sort of anchoring everybody back to what the original vision of this project was, and that is a truly clinical transformation. The vision was to be a leading health system enabled by innovative digital transformation, where we're working together. Our goal was always about better, safer, more connected care for patients and a more modern supportive system for our staff. But truly at the heart of all of this is a person, is a patient, the whole reason that why we are all here. And so as this program moves forward, we want to continue to ensure that all of our decision making is anchored back to this vision. Not just about what we are building, but why it matters in real clinical settings. Next slide, please. So as part of this, as the program matures, so has its complexity and the clinical operations, technical funding dimensions. Everything about this is changing very rapidly. And so with that, a new governance model has evolved to better reflect that reality. The speed at which decisions will need to be made over the next year is going to continue to increase. So having robust, nimble governance structures will help to enable this. Small delays can lead to large financial impacts in a project of this size if there is delays. Therefore, this structure was not about adding layers. It is about creating clarity through clear decision paths, shared accountability, and stronger alignment. And we focus back to the local delivery boards, but we also ensure that there is that clear chain of command right up to the CEOs to ensure that decision making is done in a very timely manner. Next slide, please. Within this, certainly our people are absolutely the most important. How we show up within the program, work together on key priorities, directly shapes confidence that each of our local organizations will have in a project like this. This means collaborating and participating at all levels of engagement. And this is an excellent approach to creating conditions for understanding, clarity, trust, and steady progress. So as we look at where we've been and where we're going in our next segment, I invite you to think about how you can support your teams in sharing information, staying engaged, and advancing the program to help ensure our program's transformational success. We go to the next slide. As I mentioned earlier, our people leading this change are important, and we'd like to get a pulse on how you're feeling by answering the following poll question. Do you feel supported by your local leadership to advance this program? Now I will, and hoping everybody is seeing the poll. This is a new tool for us. So please click on one of the responses, click submit. And I believe that you can also go under the polls tab across the top. If you're having any trouble, it should be there. So click on the poll and then you'll be able to see we got about 56 responses so far. Yeah, 58. If you haven't answered yet, we'll leave it open for a couple seconds more. Actually, I'm seeing at this point 65% are showing yes, that they feel supported, which is excellent. And I know that the 27%, hopefully that you'll understand a lot more of that as we move forward today. And so I'm going to pass it on to Ryan, who's going to start to take us through where we've been and then where we're heading to. So Ryan, over to you.
Okay, Mark. I'm Ryan O'Connor. I'm the program director of Bridge Northwest. I've been working with you all for a couple of years now. And so, we did a session about a year ago where we talked about what was coming up in 2025. So looking back to this one, some of the things that we've done this year, we've launched a program. You've probably seen the newsletters and the Bridge Bites and the website and stuff that come around to you. There's been leadership playbooks. So if you haven't seen any of those things, well, then get in touch with Andrew. But for sure, we have a lot of communications activities going. We've been getting ramped into the One Hits, and One Hits is the Northeast, the organization that supported the Northeast and their go live over the 23 hospitals there. So that shared services organization is helping us implement, and so we've started to we've joined it, that collaborative, and so what we're doing is trying to populate that governance. And I know that, for example, Jessica and Byron are on a number of the committees there already. A number of you have been going to the local, making visits over to the Northeast to look to what we're calling the twin sites. And those twin sites, each hospital has been paired with a hospital of like size and similar types of services, and seeing Expanse in action, seeing it being used on the floor, seeing how they've implemented, hearing their lessons learned. You've probably all seen the teams walking through with the change specialists and the IT leads going through your organization, looking at where will we need wall mounts, where will we need computers, where will we need power. So that's all been taking place over the last month. There's been validation since last summer, actually going through workflows with all the clinical working groups. So a number of you may be SMEs on working groups or no SMEs who are working through that process. I think we're going through something like 1,900 assessments and interventions in the system right now, which is quite exciting. And the new order set committee has been stood up for a few months now. So they're starting to go through the sort of critical order sets and then working through the specialty order sets over the whole year. They'll be doing that right till go live, but there's a clinical governance process to identify order sets, to review them, to review them against current practice, and make any localizations or variations we need to for the Northeast. In December, we set the scope of work. So basically by each module in Expanse, we set up what are we going to build? What are we doing? What's the scope? And we'll checkpoint that next December when the system is substantially built to make sure that we're getting what we want. And then we've been going through a lot of project management kinds of things to monitor the build over this year and checkpoint the milestones. So we'll go to the next slide. Now I'm going to say sorry. I'm a project manager. I know that some people dislike Gantt charts. I know people on my team are like, oh, Ryan, not another Gantt chart, please. But I think from a project point of view, I like these charts because they do talk about the cascade or waterfall of events that are happening over the next year. It uses language which you may not be familiar with, but you're going to get really familiar with it over this year. So I introduce it to you for you to think about and look at, but it talks about things like testing and training, training of super users, getting ready for the go live, and particularly for your LDBs over the last few weeks, you've been talking about a tentative go live date, which is super exciting. Let's go to the next slide where I'm going to give you some plainer language stuff to look at. So if I asked you to take away something from this presentation, there's probably these, what are these 9 or 10 things, 10 things that are key milestones that we should be thinking about every month, or we can be expecting to come our way as local leaders and people working on the clinical transformation. Certainly there's the local delivery boards, and you may be part of them, that are meeting on a monthly basis, and they're forming up the plans and looking at things like the non-system changes. There will be testing, training, and activation plans coming the way of the LDBs in March. We're just reviewing those right now, and one has helped us put them together. And we have our own training plan on our side that we're putting together. Local activation resources, we're going to be providing some funding so you can bring on people on your site, so you can start to work on some of those local activities to get ready for the go live. So we're going to bring those on earlier than planned so that we can get on top of the task in the LDB plans. I know from the walkthroughs, there's a number of key IT and facility changes which we've identified. Things like, we need more places to plug in WOWs, and we need to maybe extend this counter, or we need to look at the wireless or the network coverage on our floor. That's all going to be happening, sort of from now until through September. We're going to be doing testing together in the sort of September timeframe. So we're identifying which subject matter experts we want to get to bring together for testing in mid-September. So that'll be the time that you really get some hands-on to the real system, the thing that's been built, and start to see devices working and start to be able to print labels and do all sorts of different things depending on what you do. So that'll be a real test called integrated systems testing that happens at that time, and you'll be involved. Getting into the fall, and starting really in the summer, but what we need to be thinking about as leaders, who are going to be our train the trainers, who are going to be our super users on the team. So starting to look at people on our teams that can step up into these roles, and then we can start to get them trained up in the fall, and thinking about how they'll just be supporting the go live going from sort of January into March of 2027. Supporting the system on testing on live and clinical units will happen in November. That's sometimes called parallel testing, but really that is us doing a sort of final side-by-side comparison to make sure the system is doing everything we need it to do, and make some room for any last-minute changes before we get ready to go live in the new year. In December, we'll go through those statements of scopes of work again. We'll look at what was built. We'll be looking to recommend system acceptance. And there's going to be some stuff in testing that's going to come out. That's what testing's for, and the team will be remediating those things, and we'll be monitoring the progress of the remediation of the things that came out of the testing. Training, January to March in 27, and then in April we'll be looking at a go live date, and we will be supporting in each site a local command center. Okay, going on to the next slide then. Okay, so we're going to do something called a word cloud right now. It's another type of poll. You've probably seen them before. The question is, what is the biggest risk to readiness in your area right now? So go ahead and enter something into the blank there. You'll see a blank form, and there'll be a submit button. So you can say training, or you could say technical readiness, or I need a mobile thing. Here the things are starting to come up: human resources, change fatigue, capacity. And as you notice, the way the word cloud works is that the more responses on a particular area, it's larger. So, oh yeah, there's some great stuff coming through here. So human resources at the center, physician expectations, yeah, workload, change fatigue. Yeah, we talked a lot about in our training and our playbooks about change fatigue, staffing. Competing priorities. Oh, this is really good. Yeah. So, I mean, some of this, what's interesting about the word cloud is it does give you a bit of a weighting about what people are saying: competing priorities, change fatigue, a lot of people-oriented questions. Okay, that's awesome. All right, capacity and time, resources, line set, schedules for training. Yeah, so big discussion about how we're going to do training, how we're going to get people available to take the training. Just plain old staffing, because that's not just an expanse concern, but a concern overall. Okay. Good stuff. So staffing at the center right now, staffing, HR, training, human capital, workload. So people. Yeah. Validation of the build. I'm happy to see that in there. Yeah, we're going to be doing that. And if you're really interested in participating in testing, now's the time to put your hand up, because we're going to start identifying people to do that. Staff involvement. Technical readiness, yeah. Okay, very good. We're starting to settle in. We've had 78 responses. Thank you. So I assume, team, that we're going to be gathering this up. We'll see how many, we'll get a summary of this with like how many people said staffing and how many people said human resources, how many people said unmanageable workload. There's another issue, workload. We're, all related. So we'll get a ranking of this. We're gonna debrief it, and we're gonna checkpoint it against our change in education and comms plans. Okay. All right. I think we'll close the poll, and we'll go to the next slide. Okay. So next one, what we've heard from you. So what we're going to do here is we've got some questions that were sent in, and we've had a number of questions, and what we've done is we've amalgamated a few of them, because you can imagine we get a number, like you saw from the word cloud there, there's a lot of people with the same kinds of concerns. So what we've done is we've aggregated some of the questions together to create something for this presentation. So the first question is, with everything that's going on right now, staffing pressures, accreditation cycles, and competing priorities, what is the right time? Why is this the right time to make such a significant change? And what would you say to someone who feels like that their current EHR system and processes are already working well? So I'm going to toss this one over to Mark to answer. Mark?
Great. Thanks, Ryan. Yeah, I think that, this is all about having the right tools for the right job at the right time. Change is always difficult, but what we're going towards is much better integration, even better patient safety than we have today, and also access to more advanced tools. Systems are evolving rapidly these days, and our ability to move forward with things like AI and better mobility will all come from doing this. So yes, there's no really right time, but I think that this is a good time to be able to take advantage of the new technology that's out there. Thanks, Ryan.
Thank you, Mark. And lots of great topics about things that are preparing us for the future in that broad strategic roadmap that was set out by the Digital Health Council originally. So excellent. Let's go into the next question on what we've heard from you. Here's a question. We're already stretched in managing daily operations, staffing, pressures, and other initiatives. How are we realistically expected to juggle this program work on top of everything else without something giving? And I'm going to hand this one over to Jessica Lagoso and ask Jessica to answer this one.
Thanks, Ryan. And I think the short answer to this is something we'll have to give. And that's all about the prioritization that we're going to have to do. So first of all, I want to acknowledge that this is a very real question. I think we saw it in the word cloud. There are so many things happening right now in your daily operations across the system and transformation that it's not realistic that we're expecting you to do this on top of everything else and other transformation. So I want to reassure you that prioritization discussions are actively happening. We talk about it at every regional CEO meeting in terms of this massive transformation and where we need to help prioritize the work across the system and within our own organization. So I want you to know that that is an ongoing discussion, is that we're not expecting you to do it on top of everything else. The other pieces that I want to just touch on is we need to continue to hear from you in order to get the prioritization right, and in order to help sort of shift some of that work and support you where you need to. Want to just really encourage you to have open lines of communication with your leadership so that we can support those discussions. Raise it to the Bridge Northwest team, raise it to your internal leadership so that we can collectively support and prioritize that, because that is going to need to be one of our key priorities. I also just want to touch on the Bridge Northwest team. There is a reason why we're doing this regionally, is because we recognize that some hospitals will not have the capacity to do all of the work that needs to happen as it relates to this transformation and the EHR renewal. So there are resources through the Bridge Northwest team that are absolutely designed to help lean in and support you. We won't be able to do all of the work locally, but we are absolutely there to support you in figuring out how to get it done, or where we need to get sort of more hands on deck to support this work. So we hear you. It will absolutely need to be an ongoing prioritization of work. And there are resources that we will need to pivot and reassign across the region to support you in this work.
Thank you, Jessica, so much. We'll go on to the next question. And I think that, let's read this one. Given that the information of Meditech expenses and major transformation, can we have broader access to test or sandbox system? It's difficult to feel confident about readiness without being able to see and validate workflows earlier. I think I'm going to take this one because this is one of my favorite questions, which I say a bit facetiously, but everybody wants to get their hands on the system, and it's a fact, right? Like we want to see it. We're excited about the change. We want to visualize ourselves using the system. We have some things that we are doing now to accomplish some of that, but we got to remember too that we are building the system. So we can't go and log in and start admitting and discharging patients in our location system because that's currently being created. But what we do have is we have change specialists who have access to a sandbox. You can sit down with a change specialist, they can bring up their laptop and you can look at some work plans. We have through our website, you can log in and you can watch videos and demos of the system as built in the Northeast and see how they've implemented it. Excuse me. The other thing that we have for the clinical board is we're starting to provision to the first 3 to 25 users access to a system that looks like one of the larger hospitals, HSN. It's actually HSN's training environment. And the clinical board is looking at order sets and trying to understand the context of order sets in what is as close to a live system as we can get. Still not our system. So when are we going to be able to lay hands on? Well, that's September. In September, we're going to do an initial test kind of in May, which is going to be internal to the team. Like we're going to kind of try to hook everything up and see what breaks. That's the nature of that test. Then we're going to do some more fixes and changes and build over the summer. And then we'll do a round of IST again internally to do a first round, and then a second round involving all of the local sites. So that'll really be the time you start to see it and start to get access to a test system. It's the earliest we can do it. It's still a good 7 months ahead of the go live. There will be tons of training, and if you step into be a super user training, you'll have earlier access than everybody else to the system, and then training will really open up in that January 2027 timeframe. And just a reminder to all, sign up for training early. Don't leave it to the end. Is my piece of advice, because we have everybody in the last month and we don't have enough room. Okay, that's the answer to that question. Let's go to the next one. All right. There's a perception that decisions are being made for us that local sites have had little ability to influence outcomes. Given our agreed 80-20 standardization approach, how should we think about what is truly fixed versus where sites still have meaningful input? I think it's okay with the other presenters. I'll take this one as well. The 80-20 piece is something that was in our business case. And I think it's it's not a super fair description of what we're doing. It is a way to describe that we are adopting most of what the Northeast has done. And that is for good reason. Like we kind of get to see how their wave 1 and wave 2 went at one hits. They had their bumps and challenges and like they do in any implementation. We also get to learn from the lessons learned. We get to sort of see like where did they standardize like on order sets or different approaches or interventions, and it costs us a lot less to sort of be the third group in. Like we can look at everything that they built and we can go, well, this is what we need, or this is what we need to add, and the teams are truly now learning what they can add and change and vary. Like we can do variations to add local orders as an option. We can also do things like we can build interventions and assessments that we see are not in that catalog of 1900. And if we feel that we need to change or update something, we can do that. So I think there's a lot of room for creating content that suits our needs. If somebody feels a particular assessment is the one that is best for them, there's room for that. There's some constraints though, right? Like Meditech is an out-of-the-box solution. Like it works the way it works. There is certain kinds of decisions that have been made along the way around standardization, around things like how we chart or other changes like that. And I know the change team is working hard through the process of helping people understand what that change means to them and how that affects practice and what's driving what at a local level. So what I would say is, the changes to the system and your understanding of those changes, if you have a concern, like your change specialist is the first place, and if you're on a working group, that's the other place. We're logging everything, and we're also making sure that if there is a legitimate concern that somebody has that we're missing something, that we have governance and processes to take that up to the clinical board and through to the new executive committee. So that diagram that Mark showed earlier is a way that we safeguard to ensure that our quality of practice and quality of care is maintained and in fact improved. So that's my take on the 80-20 rule. It's not exactly 20%, like where's my 20% that I want? There is a gradient of like, it's a construct to think about the fact that we're not building a system from scratch. I think that's really what the 80-20 rule was designed around. And now we need to understand and work with our teams and work with the working groups and work with our change specialists to understand all the different things that that we can affect. Okay, long-winded answer, but next question. Okay. We have another question here, and this one is: how are we actively engaging providers to make sure that they're truly on board and not just informed? What are we doing to address skepticism or resistance for Go Live? So what I'm going to do is I'm going to toss this over to Martina Booth, who's our Regional Director of Nursing Informatics. Martina.
Thanks, Ryan. I thought I'd just go through kind of how we're involving providers and physicians to date, just to kind of give an overview for everybody on the call. At the beginning of kickoff, we identified a physician expanse lead at every organization that they decided who they wanted their lead to be. Those leads have been heavily involved in our provider documentation working groups, our order set working groups. In addition, we have a very large list of physician subject matter experts that we pull in as needed as we get into content that affects their areas or their workflows. We pull them in where needed just to provide their expertise to ensure that we're getting the build right and getting their input for that specific area. We do have physicians sitting on our clinical board. There's a physician from every organization that's invited to sit on the board. Some cases it's the chief of staff or a delegate. We do have physicians on our executive steering committee, which is just being formed because we were recently doing a little bit of a governance adjustment. Our CMIO, Dr. Stephen Varioki, attends the regional chiefs of staff group regularly and provides an update and answers questions. We have a change specialist, Ashley McMillan, who is dedicated to supporting the physicians and providers throughout the region. She helps with the order set work and on the various working groups that impact physicians. She also has physician office hours during the week where she is available to answer any additional questions and help them navigate any homework they might be given or any feedback they might have. She's actually looking at adjusting her hours to be outside of regular business hours to be more accommodating to the physician group to ensure that they can access her during those hours. We have a physician town hall that we are looking to begin. I think it's the beginning or the end of March, beginning of April. It falls between that time. We're going to have a town hall that's specific to that group to really address any concerns or questions that might be coming and answer anything that they might have questions about or things that we need to escalate and provide further information on. We've engaged physicians during our device walkthroughs. Some of them were engaged right in the moment during the actual walkthroughs. We've also done additional engagement for specialty areas, having the change specialist and the expanse lead from the organization attend specific meetings that the hospitals have requested in order to get ensure that we're getting their feedback and ensure that we're getting the device orders correct and that they'll have what they need when we go live. And then we're discussing internally just physician resources in general and how we can better support the physician group as this work starts to pick up a little bit more and looking at ways to really optimize how we can be supporting the physicians and ensure that they're engaged throughout the entire process and that we'll be ready for go live and hopefully address any resistance or skepticism and really make them feel confident going in towards our training and go live.
Thank you, Martina. Great answer, and I think that that engagement of everybody throughout the process is key. And like my joke today is that we have 10 change specialists. They're spread out through the region. We're adding another change specialist. It looks like so we're trimming it up to 11. That's my joke of the day around change specialists. So anyway, let's go on to the next question. And it's our sort of final one in this section. So as a leader, how do I help my team stay positive when some people are struggling with the change or feeling overwhelmed? And what is the right balance between acknowledging frustration and reinforcing direction? And to this one, I'm going to ask Byron Ball, who's a CFO over at St. Joe's, to give us a response.
Thanks very much, Ryan. And I think there's a lot of parallels between this particular question and some of the other questions that have come up. And what I would suggest is things have become in this project a lot more tangible and a lot clearer in the last little bit. As Ryan mentioned, now that we're moving into the build phase of the project, now that the clinical engagement is deeply underway, there's a lot more clarity coming to be. And I think, where you might be experiencing being overwhelmed or frustration, I'd recommend just looking for what we know and what is still unanswered in your mind. And there's numerous ways to find what we know and what you can communicate with your teams. Obviously, there's regular communications from the Bridge Northwest team. I would strongly suggest leveraging and leaning on your change specialists to help translate some of that information to your local sites. You have your local delivery boards that if you're not connected to, we can certainly point you and to help you to connect to those local boards. And the other thing is just within your own organization, having the conversations, asking the questions, and getting a sense of this is what we know today. And I don't want to pretend that we have all the answers at this point in the project. There's still a lot of work to do and questions to work our way through. But what's important right now for everyone is to ask those questions, to be engaged, to be informed of what's out there. And if things just aren't sitting right, or you're frustrated or it's not making sense, raise it. Raise the question, ask the question. That's what your local leaders want to hear. That's what the Bridge Northwest team wants to hear, so that we can be successful and move through this together.
Thank you, Byron. I think those are good points. And I think that, one of the things that we've been talking about a lot on the program lately is just like, how do you deal with the rumor mill or the back channel or all those kinds of things? It's like, yeah, raise it. Be transparent. We have a process. We want to hear from you. And it's really, really important that we bring those conversations into the forefront and have them, right? And I think there's a real power in having those with your colleagues. So thank you, Byron. I'm going to go to the next slide and then turn it over to Sandra Seibel. Sandra's going to be talking about how to stay connected and get involved. So Sandra, I'll turn it over to you. Thank you.
Yeah, thanks, Ryan. Yeah, I think what Ryan said is really important in terms of, keeping those communication paths open. We really can, if we intervene early, we can often sort of get to myths before they sort of become runaway trains. So we always like to do that, and we like to try to get people the most up-to-date, accurate information. So if you do have a question, please always let us know what that is. So we'll go to our next poll question. So, we're really starting to think about the need for more information and good information, true information. So here we have the poll question, what's the most effective way for you to receive updates? This is a select all that apply, so you can choose everything that is of interest to you. If you're watching in a group, please feel free to sort of put your answers together. And you'll also notice that there is a slide bar on the right-hand side of the poll there. So you will want to slide down and look at any more options that are there. While you're doing that, I did just also want to mention that we do have the Q&A open here. The chat is locked for this, but we do have the QA piece. We did have other questions come in that were not addressed in our sort of middle section in our presentation, but the plan is to make sure that all of the get answered. So we will have a publication that will be sort of put up that is with the copy of this recording, so that people can see, what were the other questions that people answered, what are the responses that we had there. Just some of them were a little bit more specific and not applicable to, the 100 or so people that we have here today. So we were just kind of picking and choosing pieces, but we'll go ahead and look at these poll results. Hopefully you've had a chance to weigh in a little bit. So email, still the largest sort of place to get updates, obviously right in front of people most of the time. Designated change specialist is another big one, as well as town halls. So this is good. Your answers here will help us kind of make sure that our efforts are going in the right direction. And you might find that some of these pieces become more important as we go forward. So for instance, right now, you might not find that the website has all the information that you need, but you may want to bookmark that site as more and more things become available as we get into training and other pieces. So thank you for that. Next slide, please. So I did want to spend just a few minutes highlighting for everybody what ways there are to stay connected. Some of you may know about these already. We've talked about some of them. Some of them may be new. So I won't read all of them, but I do want to highlight a few things that are happening, within the next 90 days or so, given that we're going to do these town halls quarterly. So before the next town hall, what are some of the things that you're going to see? So under program resources, Martina did talk about the provider-specific town hall. So we are looking to do that sort of end of March. And that will be a similar format to this, where providers, physicians, NPs, midwives, all that can come and get some more information that is relevant to them. For surveys, we do have our subject matter expert support survey out right now. So if that's crossed your email, please fill that out. That is very helpful to our team to know how to support you. And then in March, you'll also see both the general and the leadership level change readiness surveys come out. That's tied to some research that we're doing and some sort of higher level program planning to make sure that we're on the right track and headed in the right direction for go live. We also have our leadership playbook. The next volume of that will come out in April. So you'll see that, and it will cover the next 6 months until we get into the fall time. Our change specialist drop-in hours are ongoing. I think people are starting to understand these and know that they're available. We also have physician or provider drop-in hours, so trying to make ourselves available, but we can always meet with you outside of that. So for local resources, again, we're doing lots of one-to-one meetings. If you find you have a question, you want to meet with any of our leads or any of our change specialists, please just let us know and we can certainly do that. And I would very much like to plug as well the opportunity to have us come and speak, if you have a practice meeting, if you have any kind of event or anything that you're doing at your site, please let us know. And we can try to be there to provide some presence and talk to frontline staff about what's happening and how we are, what some of the changes are that are coming, like Ryan said, and how we're moving things forward. So I will again say, if you have questions that you want answered, please put them in the Q&A at the top of your screen there. If we don't, if I can't answer them here in real time, we'll make sure that we get to them post meeting. And I think that's it for me. I'll pass it over to Byron.
Thanks very much, Sandra, and thanks very much everyone for participating today. Just like to start with a couple of comments and recognize that we had actually in excess of 120 people giving up either their lunch hour or almost lunch hour to participate in the session. And knowing that time is the most precious commodity for all of us, but especially as leaders, I'm sure many of us had to prioritize this in your day and make time for it. So thank you very much for doing that and finding time in what we certainly feel is a key priority initiative that we're moving ahead across the region to support better clinical care. I want to pick up on a couple of points that my colleagues here presenting today made, starting with, Mark really speaking to the benefits of this system and what it's going to give us from a clinical transformation and really changing the way that our clinical colleagues do their work, your teams, each and every day to deliver safe and better care. That's the reason we're doing this. That's the reason we are all in this task. And really, my ask is of everybody here, whether you're clinical or corporate, to remain engaged and to keep that in mind when we're asking for the tasks or what may seem like yet another initiative, yet another task, to look at that end goal of the Mrs. Jones that's in the bed receiving the care and why we're doing this. So I just want to really ground us in that principle. And then I think the other thing, a couple of takeaways that I'd ask everybody to look at. I, like Ryan, am a project guy. I love the Gantt chart. You will have the material sent out afterwards, and I'd strongly encourage you, maybe not for the Gantt chart, but for the key tasks of what's happening when and what does it mean to me, to look at that and reflect upon what does it mean for myself as a leader in our organization, in our role. And that'll give you a sense of what's to come and what we're asking and what we really need from each and every one of you to be successful in this program over the next, what is really 14 months from now to we're contemplating for go live. And the final thing I think I'd like to touch on is what Sandra spoke of in terms of getting engaged and how to get engaged. And I go back to the question that was tabled about, how do I balance this? What is my role as a leader? And certainly we are asking for your help in spreading the word about this program. And equally, we're asking for you to come to us when you're uncertain, where you're not clear, where things aren't necessarily making sense. And there probably will be moments in the next year plus where that'll come up. So please, rather than sitting with that individually, bring those forward in conversations, table those questions. I know I certainly drive our team collectively nuts with all the questions I ask. And I think my last very tangible ask is for your feedback on today's session. This is, thank you to the team that put this session together. While those of us presenting make it look simple and seamless, there's a lot of work that went in behind the scenes. So any input, this is truly a means of us engaging and communicating across the region with clinical and corporate leaders on this project. So your input into how to do this better is critical, because we plan to do this again at least a few more times before go live. So any input you have on what worked well, what didn't work well, is really valued and appreciated. So on that note, I think we'll give you a couple of minutes back and thank everyone for your time this afternoon, and have a great day.